Hey, hey guys, it's us. We're back with Beyond the Exam Room. I am Dr. Emily. I am a board certified family medicine physician located right here in Charlotte, North Carolina. And my lovely co host is going to introduce herself, although y'all know
Yes.
us.
Good to see you all again. I'm Dr. Akita in primary care in the Atlanta metro area.
So today, we are going to talk to you guys about high blood pressure, right? And it's not a sexy topic, it's not the main thing or the hot topic of the week, but of course as primary care physicians, this is something that we see every day. So
Every
we
day.
felt that it was pertinent to come on and just have this conversation now and just give you guys some information that you may know, some information you may not know.
Mhm. Before we got started today, I was telling Dr. Emily that I had a patient encounter yesterday, and
Hmm.
I realized I need to do a better job of connecting the dots. So
Yeah.
I was talking to him about his blood pressure, and it was uncontrolled. We
Hmm.
were talking about goal, blood pressure, all the things. And then I said, Sir, I want to make sure that your heart's protected, your brain's protected, because we're doing stroke prevention. And I
Hmm.
realized that oftentimes we're missing those dots. Blood pressure control is about a lot of things. Well, most of it is stroke prevention, heart attack
That part.
prevention.
Let's prevent death.
Yes.
Why not prevent death? That's important, right?
Yes.
So, yeah, and I agree that sometimes, while I know that both you and I do a great job of educating our patients, you take your medicine the same time every day, eat the right diet.
Yes.
Sometimes we miss that important piece of, yes, this is why it's important because this is your risk and it's a very real risk. So that's a great point that you bring up.
Yeah.
Yeah.
Yeah, when we're talking about preventing organ damage, I often
Hmm.
talk about like eyes, prevent blindness, brain
Hmm.
prevent stroke,
Yeah.
kidneys prevent end-stage renal disease. We
Hmm.
likely all know somebody in our personal life who's been on dialysis, and
Right.
heart to prevent a heart attack. And so that is why the blood pressure control is important. Sometimes when I'm describing blood pressure, I literally say it is the pressure that your vessels are under.
Yes.
And when your vessels are under this pressure, it damages the vessels, but they can also compromise blood delivery to your organs. So
Hmm.
when we're thinking about strokes, I mean, there are some people who are born with rare abnormalities that can lead to
Right.
strokes, but for the most part, most strokes are one of two types. Either hemorrhagic,
Hemorrhagic.
meaning
Hmm.
yes, there's a bleed on the brain. We may hear
Hmm.
that describe that, where there's a bleed on the brain leading to a
Yep.
stroke, or ischemic, meaning there's not enough blood delivery.
Correct.
And hypertension can lead to both types.
Hmm. My favorite analogy, especially, when I have my male patients in the room, I
Hmm.
say, okay, have you ever pressure washed your house or had it done? And,
Yes.
they'll be like, well, yeah. I'm saying, the force of that water is getting the dirt off your house. And I say, high
Yes.
blood pressure is the same thing. It's you pressure washing 100% of the time, 24/7.
You're
Your
right.
arteries are getting pressure washed. Do you think that's a good thing? And that really will turn on the light bulb. So that's a great
Yes.
analogy also. Just that pressure of the blood flow in your arteries is just not healthy. So,
Right. Because then it compromises the actual vessel. So when we're thinking
mhm,
about if your arteries are under all that pressure wash
mhm.
24/7 for years and years
Years.
and
Yep.
years,
Yep.
the damage that's being done to those artery walls, and the body is like, no, let me repair myself.
Hmm.
And but the
Hmm.
repair can lead to more
The
damage.
more damage.
So
Yep.
the prevention is normal blood pressure.
Hmm.
I often have people, so we'll get through all that intro talk, and then we're like,
Yep.
okay, take a medicine, do the lifestyle changes. So I
Hmm.
often hear, but how long will I have to be on this? You ever hear that? Well, when can I wean off?
When can I stop? I had a
Yes.
patient just a few days ago. Blood pressure is beautiful now. Okay, that means I can stop the medicine. Mm-mm, no, you can't. The medicine is helping your blood pressure stay controlled. So let's let the medicine work while we see what other things we can work on to help keep your blood pressure controlled. So, yeah.
Exactly. And we've had cases where people can wean down. Some
Hmm.
people do major overhaul. So
Yes.
whether the treatment is a medication or
Hmm.
weight loss or diet
Hmm.
change or stress, there are many ways of getting to a goal. But
Absolutely.
I often will have people, especially if they're new to me, say, "Oh, I stopped it because my blood pressure got better." And it's
Better.
like, well, if the treatment was not replaced by a major lifestyle thing, then we're
Yeah.
going to need treatment. So I
We're
say
gonna
we're going
need
to get to
treatment.
goal, however we get to goal. We make sure we
Mhm.
stay at
We
goal.
stay at goal, yes.
Yes.
Because again, pressure washing the inside of your arteries. So let's make the
Yes.
medication work while we add on the lifestyle modification, the weight loss, the whatever we need to add on to make
Yes.
sure that we can keep your blood pressure much more controlled.
Oh, yeah.
What do you say to people who say, "Oh, well, 120 over 80, that's not really normal for me. Normal for me
Ooh,
is, 145 over 95."
I hear that all the time.
Yes. And I'm
You
like,
know,
no,
I
no,
was thinking about this earlier today, just how much stress we put our bodies under to compensate.
definitely.
So even though it wasn't their normal,
Hmm.
it wasn't their baseline, it doesn't mean that their body didn't need it. So for
Right.
years or decades, we're forcing our bodies in some instances to
Hmm.
function
Hmm.
under abnormal circumstances.
Right.
And so I like to explore what attempts have been made in the past to control
Hmm.
blood pressure. Was it
Hmm.
because medications weren't tolerated? Was it because they didn't explore other underlying conditions?
Right.
Because sometimes people need a renal ultrasound to look at their kidneys.
Yes.
Like other,
Yes.
what has been done to explore is this really essential hypertension, meaning the run of the mill, what we usually see,
Right.
versus the high blood pressure as a secondary issue.
Hmm.
So it goes back to history. What has been done in the past to work it up? What has been done to treat?
Hmm.
Has there been a medication adherence issue? Is it an access to medication? Is
Right.
it needing more counsel and lifestyle changes? Because I'm like, we can get
Hmm.
to goal.
Right. Yes.
Yes,
Yes.
yeah, we can get to
And that's an
goal.
important point, especially, for you folks out there that maybe you just got diagnosed with high blood pressure.
Yes,
It is certainly reasonable to ask your physician, okay, is there something else that's causing my blood pressure?
yeah,
Because I want to make sure, and you'll hear Dr. Akita talk about this on her Instagram and all. What is the root cause, right? So we
yes,
want to make
yes,
sure we're
yes.
treating the root cause, and
Hmm.
neither myself nor Dr. Akita are just, oh, throw medicine at you type people.
Yeah,
But sometimes you need to ask that question because,
yeah,
if your doctor is hurried or whatever, bringing that up to say, well, it doesn't run in my family or I don't have this,
right.
are we sure that this is the cause of blood pressure? So that's where advocating for yourself to make sure that you're taking proper care of yourself and that you know what's really going on is important. I just wanted to throw that piece in there.
And that brings up that was all great. Thank you. And that also reminded me of sometimes we go to the doctor, blood pressure can be elevated, but
Hmm.
the story is at home, it's not. And so that brings up the whole
Yes.
discussion of white coat hypertension. And
Hmm.
so it's helpful to monitor to know your baseline in your home.
Right. Right.
Because if you're going to a doctor's office or a hospital setting and it's elevated, but that's not your baseline, you don't want
Hmm.
to make medical decisions or healthcare decisions based off of an elevation that's temporary.
Yes. Yep. Yep. That's good. And then, when you're high blood pressure, and we're not going to get in the weeds of this, but understanding that if you have high blood pressure and you have diabetes
Yeah.
and you have high cholesterol,
Yes.
then that we're looking at you, there's a much more urgent concern, if you will, or urgent need to get all of those things under control because having all of these things, there's a lot going on in your body that is just increasing your risk for the
Right.
things we talked about earlier, the stroke, death. And we don't
Right.
want this to be doom and gloom, but understand that having high blood pressure is serious.
Oh yeah.
Some people, it's just one pill, other people, oh, I control it with my diet, but yeah, it's
Yeah.
serious. So we take it seriously. We look at your total picture. What
Mhm.
other diagnoses do you have? How do we need to help you get to goal to stay at goal for everything? So adding
Yeah.
on these other diagnoses and the old term used to be metabolic syndrome,
Yes,
it
yes.
definitely puts you at a higher risk.
I appreciate you saying that because as you were talking about the different conditions, I was
Mhm.
thinking of a lot of times there are similar root causes, similar
Mhm.
underlying processes. And
Yep.
so the thing that can help one lifestyle wise may also help the others. And
Yes.
then as you were naming all the conditions, I was thinking about the increased risk for inflammation,
Yes.
the change that has to happen for some people,
Hmm.
major overhauls, and how
Yes.
that can also lead to mental health impact.
Mm-hmm.
So
Mm-hmm.
one thing we have not said is May is Stroke Awareness Month, but it's also
Yes.
Mental Health Awareness Month.
Yes,
And so a
absolutely.
lot of those things can run together. We know that when there's a new diagnosis of a chronic condition, we should
Mm-hmm.
also screen for mental health changes.
Yes.
It's a
Yes.
lot. It's a
It's a
lot to
lot.
go from, oh, nothing's wrong. I don't take any medicines. I don't have to go to the doctor except for my
Mm-hmm.
physical, to now I
Mm-hmm.
have major lifestyle changes, nutritional
Yes.
changes. The foods that may have provided comfort are now feeding the conditions.
Correct.
You
Yes.
know,
Mm-hmm.
that can lead to a lot of changes to mood.
Yeah, it's a
Yeah.
lot. And from personal experience, when I got diagnosed with high blood pressure last year, so I go to my GYN appointment and it was high. And I'm like, oh, y'all just don't check blood pressure right. So she's like, no, I want you to go see your doctor. And it was like 158 over 95 or something
Yeah.
ignorant like that. And so I'm like, I don't trust their machine. Same things patients say. So then
Hmm.
I go see my primary care doctor and she's like, what you gonna do is take this medicine. And of course, my family history, high blood
Yeah.
pressure, diabetes, all of these things. But even I went through it. I went through the denial. I went
Yes.
through the anger because I thought that I was taking good care of myself.
Yeah.
And I'm like, oh, I ain't going to take this medicine. I went through all of those things until I
Yes.
finally had
Yes.
to have my own come to Jesus and be like,
Yes.
I'm going to take this medicine because I got
Yeah.
living to do. And while I take this
Yes.
medicine, I'm going to work on the lifestyle modifications,
Hmm.
making sure that my diet is right. So you're not alone in this.
Right.
I've gone through it and went through all those stages of change, the stages of grief, they're about all the same. To
Yes.
get to the point where I'm like, no, I need to take better care of myself. So yeah, it is.
Yeah.
It's a lot. And it's easy, and I want you all to hear me. It is easy to get a diagnosis like that, whether it's blood pressure, diabetes, cholesterol, anything that may seem minor, but it really throws you for a loop. And so, if
Oh
you
yeah.
already have a history of depression or anxiety or whatever, and then you get this major medical diagnosis, talk to your doctor so that we
Hmm.
can help you work through it. Because the worst thing you can do is to sit and you're not taking care of yourself, you're not taking care of your medicine, we're not helping your mind. When the mind is sick,
Right.
the body is sick, and that's real. So
Exactly.
it is so important to talk to your doctor about how you're feeling about your diagnosis.
Yeah. Thank you for sharing all that. That is freeing for a lot of us.
Mm-hmm.
And it's something that we don't give a lot of attention to.
Yeah, we
I
don't,
even think
especially in our
about all,
communities. Mm-hmm.
oh yeah, because it's
Mm-hmm.
like if mood isn't optimized, who's gonna feel like
Mm-hmm.
taking it? Who's gonna feel like meal prepping? It
Exactly.
just goes together. So thank you for that.
Exactly. Definitely.
Dr. Emily, when I was thinking about May being Stroke Prevention Month, I
Mm-hmm.
was thinking within the last 5 to 10 years, I know I have seen more and more younger women, in
Yes.
particular Black women, having
Mm-hmm.
strokes in their late 30s and 40s. And when we were
Yes.
training, that was we were not seeing it.
No, not at all.
So you've been seeing it too?
I have, and it makes you wonder what is different. We hear a lot about, where in the United States the food isn't made the same as it is in other countries. I also think, while I think that that may play a role, there is increased stress
Yeah.
right now. There's increased stress. There are issues with access to care.
Yes,
If
yes.
you, whether that's access being I don't have insurance, or access being my job, I can't take a day off to come to the
Yeah.
doctor, or access being I'm too busy doing all the things that as a woman I have to do, and I just don't make time or don't have time to see a doctor. So I agree, it's on the rise. And sometimes women are like, well, I'm too young, I don't have to worry about that. Well, yeah, we shouldn't be waiting until 40 and 50 to really consider that possibility. What about you?
Yeah, I agree with all the things. I was thinking, it may take a while for research to shed more
Mm-hmm.
light, but we're on the front
Mm-hmm.
lines. And what we
Mm-hmm.
see, we have the decades of experience and the clinical experience to know that there has been a shift. I
Right.
think it's everything that you've named and even maybe things we don't even recognize yet.
Mm-hmm.
Which is why, I appreciate the Stroke Awareness Month. I'm even thinking about my own family, and we're
Yeah.
seeing things younger and younger.
Mm-hmm.
that
Mm-hmm.
we weren't, so it's nice that we're stopping and we're pausing and we're like, yes, this is Stroke Awareness Month. And also, we know that prevention happens with our daily choices.
Yes, definitely. Definitely.
Yes, it happens with our daily choices because these choices compound, over the days, the months, the years, the decades. So every
Mm-hmm.
time we choose to go to bed and get rest, every time we choose to take a walk and how that helps our blood pressure and our blood sugar, or to exercise routinely, and our
Mm-hmm.
daily food choices and our
Yes.
daily stress relief techniques, we're
Mm-hmm.
preventing stroke, we're preventing heart attack, we're preventing kidney disease, especially if there's a family history. We've talked
Definitely.
offline about, what our grandfathers experience, health wise, and what our
Yeah.
cousins. So, especially when there's that family history, we need to take it even more seriously in thinking about the impact of our daily choices for stroke prevention.
Totally agree. And wow, and I'm a fan of journaling just to talk about the stress
Yes.
management. Listen, I love writing in a beautiful journal, writing my thoughts
Yeah.
and stuff. Friends, that is not getting the stress out of your body. We need physical. Think physically getting the stress out. Writing is
Yes.
beautiful. It calms you. It may help you rest. I still
Yes.
need you doing something physical to get that stress off of you because if you keep it inside, which journaling is still an internal way of managing
Yeah,
stress or
yes, yes.
helping you sleep or relax or being creative, we still need the external, getting it out, running, jogging, get a
Yeah.
punching bag if you need to
Yes,
and
yes,
punch it
yes,
out. But we've got to
yes.
get physically that stress out of our bodies because it builds up and it's not healthy.
Yeah, something I was thinking about when you were talking is, yeah, I agree with all of that. And also, I try to make it a point personally that my stress relief is not causing more of an issue. So when I think about people who may eat away their stress, and this is not
Mhm.
judgmental, we talk to people all
Right.
day, so I see all the things, who
Yes.
may eat away their stress or stroke away their stress,
Mhm.
not stroke, excuse me, smoke away their stress.
Oh, yes. Hmm.
We want stress relievers that are not creating another issue or
That is
adding
correct.
to our health issues. So things that
Right.
are really health promoting.
Hmm.
Yeah. So that's
Hmm.
just something that I think of, even with myself. I'm like, let me make sure what I'm doing is actually benefiting myself.
Yeah,
Um,
that's good. And that emotional eating piece, because you may look at it as, oh, well, I'm not an emotional eater, but when you're stressed, the first thing you grab is that
mhm.
half a gallon of ice cream or
Something,
that
yeah.
bag of potato chips, or
Hmm.
even if it's mindless eating. And that's something that you may need help with. Again, that's
Yes,
the mental health side of stroke
exactly.
awareness. So once you have established, okay, you don't want to call it emotional eating, fine. But if it's I'm stressed and I go to the chips, I go to the ice cream, I go to the
Hmm.
candy,
Yeah.
it's time to get some help. If you're at a point where, okay, I know I need to stop, but I can't, it is okay to ask for help because what
Oh,
we
yes.
want is for
And
you.
and
You
those.
asking for help is that stroke. We don't want that.
Yeah, 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 yeah. We were saying earlier, Dr. Emily was saying how patients will say, I don't have any symptoms. We want to,
Yes.
yeah, yeah, I
We
feel
don't want you to
fine.
have any.
Yeah.
And symptoms are bad, especially where it relates to high blood pressure and
Oh,
stroke.
for
Yeah,
real.
we don't want any symptoms. And speaking of symptoms, that is a perfect segue. So, really
Yes,
quickly,
yes.
we know you guys see those commercials about how to recognize a stroke and all the things like that. We just naming them really quickly. If there's a
Yeah.
change in your speech, I even had a girlfriend who she couldn't speak. So that was her change in speech. It may
Yeah.
not be slurring, it may be she just could not, the words just would not come out. Facial numbness, weakness in the arm,
Mhm.
stumbling gait, any of those things, that's a change. Yesterday you were completely fine.
That's right.
Today something is different. Don't wait.
Hmm.
Go in and be evaluated immediately.
I agree. I'm even thinking of people just changing cognition, changing vision. If it is
Yes.
not your normal, get
Yes.
evaluated. Hmm.
Yes. That's yes. And that's a good one because sometimes there may not be the physical, but
Yeah,
you were just talking to your husband and now an hour later he's
right.
confused and you're like, we just talked about this an hour ago. That is a change that you need to take
Yeah,
seriously.
seeing
And note when you
confusion.
And the important thing, note the time that it happened because
Yes, yes.
time is blood flow. Time is flow. So getting to the ER and letting them know at this time, this is the change that I observed in my loved one or whatever. Mhm.
Yeah, because Dr. Emily and I was thinking about that earlier today. We both trained in the emergency room, so we see how important
Mhm.
timely intervention
Mhm.
is. It
Yes,
changes the treatment plans. It
it
changes
does.
the trajectory for recovery. So yeah, that time is very
Absolutely.
important.
Absolutely. And you want to go in saying, these are the things, this, and this, and it happened at this time.
Yes.
That makes a difference. Yes,
Mhm.
definitely. All
Hmm.
right. Well,
Wonderful. Yeah.
we have had an awesome conversation. We talked about
Yes,
so many things. We done talked about blood pressure. We done talked about stroke prevention. We done talked about mental health. Like this was a
we
really
have.
good conversation, and I enjoyed it. I
Yes.
hope y'all did too.
Yes. Yes. We look forward to joining y'all here again in this space next month where we have another episode of Beyond the Exam Room. In the
Yes.
meantime, you can connect with us on social media, on Instagram and Facebook.
Mhm.
I'm under my name, Dr. Akita Evans.
And you can find me, Friendly Neighborhood Family Doc, on all the things TikTok, Instagram, and Facebook. So looking forward to
Mhm.
seeing you guys there and interact with us. Let us know on either of our pages if there are any topics that you would like for us to cover. If you have burning questions, these are all things that we're looking to engage more with you. So we'd love to hear
Yes.
from you.